Dear student, in today's lecture, we will learn about the examination of the newborn. Examination of the newborn has been described in our Samhita Granth also. If you will see the most ancient Samhita, that is Charak Samhita, in Shariristhan, Acharya has described the Lakshan. That Praman Sharir Acharya has described there. In Kashyap Samhita Sutristan, in Lakshana Adhyay, Acharya Kashyap has described the examination of the newborn as per the symptoms or the examination of the newborn. In Ashtang Sangrah Uttar Tantra and in Ashtang Hridaya Uttar Tantra, Ashtang Hridaya Shariristhan, there are references for the examination of the newborn. Now see, in the Lakshana Adhyay, Acharya Kashyap has described the very first physical examination of the child and also given the symptoms or the features of long life in infants. To know the longevity of the baby, the detailed examination of all the major and minor body parts mentioned there, proportionate measurement with finger breadth, Acharya Charak has mentioned in Sharir Praman, voice nature, dominance of dosha, prakriti assessment, and then physiological activities. For example, have a look on sucking, like how baby is intaking the milk, urination, defecation, sleep, cry, smile, etc. Charak Samhita, 8th chapter, Shariristhan, Ashtang Sangrah Uttar Tantra, 1st chapter, Ashtang Hridaya Uttar Tantra, again 1st chapter, and Kashyap Samhita Sutristan, chapter number 28, Lakshana Adhyay. Now in Lakshana Adhyay, Acharya has first mentioned about hair. One hair should grow from one follicle. This is only admirable condition, that one hair and one hair follicle coming out from one point of the skin. Hair should be soft, lesser in number, it should be shiny and well rooted. Black color hairs are admirable. Acharya Charak has told Krishnaha Kesha Prashishyante, means black color hair are admirable and they are the best. Now when they told about the skin, he has told Sthira Bahalatvak. Sthira, it is not to be slick. Behal, that is compact, thick or solid. Now head, normal head, slightly more in size, rounded, proportionate with respect to the body, and umbrella shaped head is admirable. Now forehead should be semilunar. Skin get wrinkled when baby see upward. Now abnormal head or less or more in size, like microcephaly or macrocephaly, not rounded, one which is not round, one which is not proportionate to the body, as I have told in microcephaly or the macrocephaly. Any abnormal shape of the head other than umbrella shape. Forehead, if forehead is not semilunar, skin gets wrinkled when baby see upward. Now here you can see in the picture, congenital disorder of the glycosylation. These pictures are demonstrating microcephaly, flat forehead, dysplastic ear, short nose, retrognathia, and irregular insertion of the toes. Now anthropometry at the birth. Normal anthropometry at the birth. Normal length of the baby is 50 centimeter. Weight of the baby is 2.5 kg. Heart rate is 120 to 140 per minute. Rate of respiration is 30 to 40 per minute. Head circumference is 35 centimeter and chest circumference is 37 centimeter. Here you can see that head circumference is slightly smaller than the chest circumference. By the age of 1 year, it becomes equal, or head circumference is, okay, it becomes equal. Now, how to measure the crown heel length? To measure the crown heel length in the child or the newborn, because here I'm talking about the newborn, we use infantometer. Infantometer has two ends. One is mobile end, while the another one is immobile end. You can see where the head of the child is fixed, that is immobile end, or you can say stationary end, while the second one, where you can see the legs of the baby, feet of the baby touching that infantometer, that is mobile end. That is, that can move. Okay. So you can understand, to measure the length of the baby, we use infantometer. Now, what is the importance of anthropometry? Anthropometry becomes important when we have to look out for malnutrition, for the grading of PEM, that is protein energy malnutrition. What is the severity of malnutrition? If a condition like failure to thrive there, an evaluation or gradation of stunting. Shakir tape method or the mid upper arm circumference is best indicator to assess the PEM. But thing which becomes important here is mid-upper arm circumference is only taken in the child 6 months to 59 months of age. Remember, MUAC should not be measured in the child less than 6 months of age. Head circumference gives the early probability of either macrocephaly. With the help of head circumference, we can see either the head of the child is microcephaly or the macrocephaly is there. It also indicates any genetic abnormality or the CNS, that is central nervous system abnormalities, or the hydrocephaly is there. CC helps to guess any cage deformity or detection of respiratory or the cardiovascular diseases. Now, how to assess that newborn is mature or not mature? There are few criteria such as scalp hair, cartilage, ear cartilage, breast nodule, female genitalia, male genitalia, sole crease, neurodevelopmental, neurological development, and look. Now here you can see preterm baby, term baby, and the post-term baby. As we have already discussed, what is preterm, that is less than 37 weeks of age, and term 37 to 41 weeks of age, and the post-term more than 41 weeks of age. First see what is term, and then we will see the maturity of newborn as in that criteria in preterm and criteria in post-term. Okay, in term newborn, coarse and silky hair will be present. Ear recoil will be present as well as ear cartilage will be present. When we will see the size of breast nodule, it will be more than 5 mm in diameter. Remember, it will be more than 5 mm in diameter. In the newborn, it indicates the maturity of the newborn. Female genitalia, labia majora will cover the labia minora. Means labia minora will be covered by the labia majora. Now, male genitalia, both the testes will be descended in the scrotal sac. Both the testes will be descended in the scrotal sac. Now, sole crease, several deep creases will be found. When we will see the sole of the baby, there will be presence of deep creases. Now, neurological development, here it will be good. Look of the baby will look active and the healthy. Okay. Now see what criteria or what symptoms will be there in the preterm baby. Scalp hair will be brownish, fuzzy or woolly. Ear cartilage will be absent. Recoil will also be absent. The nodule of the breast must be less than 5 mm in diameter. And as far as the female genitalia is concerned, labia minora will be exposed. Means it will not be covered by the labia majora. Now, male genitalia, testes will not be descent in scrotal sac or very small testes will be there. Sole creases will be superficial. Neurological outcome will be poor. Development will be poor. And look will be thin and wasted. As far as the post-term baby is concerned, every features will be as similar as the features found in the term baby, except the skin scales. Skin scales will be visible in the post-term, which was not visible in the term baby. Now see how to evaluate the newborn. Detailed physical examination soon after the birth to detect. Why to do physical examination? To detect any congenital anomalies, to detect any birth injury, to see the patency of the orifices and any other disorders. Now, one thing which I will discuss here, that how to fill the neonatal examination form or how to do the neonatal examination. Okay. First of all, the thing which is important is antenatal history. When we are going through the antenatal history, we will ask for the last menstrual period of the mother. What was the LMP? And from LMP, we have to calculate the EDD, that is expected date of delivery. Now, immunization during the pregnancy, if mother has been immunized for TT or And what is the approximate gain of the mother during the entire gestational period? Usually this weight gain is approx 11 to 12 kg. If mother has suffered from any illness during the pregnancy, like toxemia of pregnancy or torch infection or any other disease condition like diabetes, hypothyroidism, if mother has suffered. Now medication during pregnancy, if she was taking any medicine, she was in any medication, okay, then you have to mention here. Usually iron folic acid supplementation and the calcium supplementation is given during the pregnancy. Okay, if any investigations she has undergone, usually complete blood profile, you will have complete urine examination, you will have, apart from that USG, you have to mention that either USG or blood profile or urine profile. Now, what to write in birth history? In birth history, nature of the delivery, either it was normal, as we write it as that spontaneous vaginal delivery, or assisted. If it is assisted, then it was vacuum delivery or forceps delivery, you have to mention. Second, if it was LSCS, that is lower segmental cesarean section. And when you are writing the LSCS, you must have to write either it was elective cesarean section or emergency. Like in case of fetal distress, it will be emergency, or in some other conditions, in case of oligohydramnios, it will be emergency, or sometimes patient also prefer the elective cesarean section too. Now, indication of LSCS, as I have mentioned, either elective or emergency. If emergency, then mention what was the situation there, and then mention the date of the birth as well as the time of the birth of the baby. Now, you have to write that is baby cried after birth, immediately after birth, just immediately after birth, either yes or no. And what type of cry was there? It was vigorous cry, feeble cry, or the poor cry. After writing all these things, we come to APGAR score. In APGAR score, we have to look for appearance of the baby. What is the color of the baby? Either baby is cyanosed or color of the baby is normal, that is pink. What is the heart rate? Either it is absent or more than 100 or less than 100. Okay. What is the grimace? What is the activity of the baby? What is the rate of respiration, which is usually 40 to 60 per minute? And accordingly, you can maximum give up to 10 score in the APGAR, while minimum 0 can be also. But 0 is the poor prognosis. And remember, APGAR is prognostic. This is neither diagnostic nor therapeutic. Now, what examinations we does there? See the vital signs. Heart rate, which is usually 140 to 160, 120 to 140, sorry, and rate of respiration, which is 40 to 60 per minute. Write down the temperature, and now also write the color, either baby is looking cyanosed or pinkish in color. What is the CRT? CRT is capillary refill time. If it is less than 3 seconds, then it is okay. But if it is more than 3 seconds, then we have to also evaluate for the any hemoglobinopathies. Now, what are the neonatal reflexes to be evaluated? Glabellar tape, rooting reflex, sucking reflex, Moro reflex, and some other reflex we also see there. Now, anthropometry I have already discussed, so I'm not going to discuss here. And to assess the maturity, we use the Ballard score to assess the maturity of the newborn. Now, see, if baby has passed the meconium or not. If baby has passed, then write it as yes, meconium has been passed. Then urine passed or not passed. Then you also have to write what is the frequency per day or per night. Then feeding history. It has been recommended that feeding should be immediately start just after the birth. So you have to ask the mother, feeding has been immediately started after the birth, yes or no. If no, then first feed given at what time? Breastfeeding started at which time? You have to mention the time at which the breastfeeding has been started. Now, quantity of the milk is sufficient or insufficient. You have to ask the mother, and if baby is feeding well and then sleeping well, not crying or not suffering from any other complaints, then it can be considered that milk is insufficient. And then at what interval mother is feeding to the child, breastfeeding to the child. It should be ideally 2 hours interval there. Now, darshan is Sparshan Pariksha, that is physical examination. See the upper part. In hat, anterior fontanelle depressed, or if it is depressed or bulging or normal. See the scalp, if cephal hematoma is there or caput succedaneum is there or any other abnormality you can see there. And then face is normal or the dysmorphic. Usually dysmorphic face is found in syndromic conditions. Now neck, normal of webbed neck, like webbed neck is found in that Turner syndrome. Now middle part, that is chest. If any abnormality is there, see the shape of the chest or any other abnormality, then write it down. Shape of the abdomen, it is not at all scaphoid, it is scaphoid. is not a normal abdominal shape in newborn, because if scaphoid abdomen is present, then it may indicate the diaphragmatic hernia too. And see the back. If any deformity is there, then you have to mention that. External genitalia organ, check the patency, and then an extremities upper and the lower. Usually see if any abnormality is there. What is the condition of fingers? If polydactyly or brachydactyly, you have to mention. Now in inspection, you have to see any cyanosis, pallor, clubbing, or icterus. If congenital anomaly any present there, like atresia or cleft lip or cleft palate, birth injury, if any, and neonatal care, if routine care has been provided, then write down the routine care, or if due to some resuscitation or any other complication, if special care has been provided, then you have to mention. And then what advice we usually give to maintain the proper hygiene and antiseptic dressing of the umbilical cord, and proper hygiene and proper cord care. And exclusive breastfeeding is recommended to your child, and inform the doctor SOS if required. And final remarks that baby is healthy. And this is all about that how to fill the newborn examination, how to do the newborn examination, and how to write it down. That's all about this lecture. Thank you.